All right, my little baby nurses, welcome to another educational breakdown from Talk, Teach, Nurse. I am Shatar Shade. I am your favorite instructor, and we are on here today to learn how to break down Nclex questions, right? So I was teaching today. We kind of getting ready to graduate soon in April, so therefore I'm kind of breaking down different Nclex questions and how to properly answer the question or understand what is being asked in the question. So let's take this example. Note that we do have a lot of simple questions and practice questions that are located in our YouTube shorts. So make sure you check those out along with these videos and the other educational videos as well. So let's get to it. A nurse is assessing a client who has left sided heart failure. Which of the following findings should the nurse identify as a manifestation of left sided heart failure? Your options are A, dependent edema, B, jugular venous distension, C, weight gain, or D, frothy sputum, right? Now, when you first initially look at this particular question, first I want you to understand that a nurse is assessing. This is assessment. This is something I'm looking for. This is something that I'm trying to figure out, right? At that point, we note that we're going for left-sided heart failure, right? And next up, we're going to say, what is a manifestation? What are some of the signs and the symptoms that is associated with left-sided heart failure, right? Now, one thing I want you to do, and this is some of the things that's very tricky with what Nclex tries to do. As we all know, edema can be associated with it. Jugular distension can be associated with it, as well as heart weight gain, as well as frothy sputum can all be associated with congestional heart failure, right? However, we are sitting here looking at left-sided heart failure. At this point, I want you to think about how the blood flows through the heart. At this point, we know that we enter from superior, inferior vena cava, and we enter into the right side of the right atrium. From the right atrium all the way down to the left right ventricle, from the right ventricle up into the lungs, and then we return back to the left side of our heart. Right, left atrium, left ventricle, out the aorta. What you note here, all of these answers are definitely possible if I'm just thinking about overall congestional heart failure. However, disassociating with the left, right? We know that the right side of the heart is supplied purely by from the rest of the body. So with the right side of the heart, when it is congested or the heart starts to fail, I look at the fail as a point as like a traffic jam. So therefore the heart started to fail, kind of pause, kind of stop, not pump properly at this point. So based off of that, I know that edema I'm thinking of will be associated with the right side. I know the jugular vein is distension because I know the jugular vein empties into the superior vena cava. That's going to have some type of distension because I know that the right side is failing, the right sided traffic jam basically, not functioning properly. So that jugular venous distension is going to be, or jugular distension is going to be associated with the right side. Now the weight gain, we know that we have that edema that's associated with the right side of the heart failing. And with that being said, we know all three of those things are going to be associated with that, right? Now, when I think of the left side, I know that the left side of the heart is basically supplied from the lungs. I know that the lungs can be affected when the blood starts to back up or not, when the heart is not functioning properly and cause that frothy sputum. As a matter of fact, it's that pink kind of little light blood tinge pink frothy sputum. So therefore, when you look at these questions, I want you to first figure out exactly what is the question asking, right? I tell my students all the time, read the question, read the answers, and then read the question again. Reading the question at first is kind of giving you an overview of like, hey, what are they trying to ask? Reading those answers is kind of allowing you to say, okay, dependent edema, this is what I'm working with. Jugular distension, this is what I'm working with. The weight gain and the frothy sputum, correct? At that point, we're going to say, okay, I know what I'm looking for or what my options are. Now let me go back and make sure I fully understand the question. I don't want you to get to a point to where you are rushing. I understand Nclex's time. However, don't get to that point to where you are rushing and you are forced to just pick an answer or you haven't fully understood the question before you chose your answer. So that's why I say read the question completely, reread, and go back and pick your answer. But make sure you fully understand before you actually pick your answer and move forward to the next question. Now, as you see here, I went and broke down, understanding if we understand what heart failure is, I can get an idea of what are the signs and symptoms or those manifestations I'm looking for. And then I'm able to determine if this is a left side or right side signs of heart failure. And based off of those things, then I'm able to answer this question properly. So as you can see here, your answer as we move forward is going to be the frothy sputum, right? Since it shows here, the nurse is going to identify the frothy sputum, dyspnea, and wheezing are manifestations of left-sided heart failure. Treatment includes the fluid restriction and the diuretic. That's when we're going to go ahead and issue that Lasix and kind of pull some of that fluid off of the patient. This allows to decrease the preload and reduce pulmonary congestion, as well as the pink tinge frothy sputum is an early indication of the pulmonary edema and can be life-threatening. So therefore, you should notify the provider immediately. So like I mentioned before, just make sure you are reading the question, reread, and then select your answer to make sure you have a full, complete understanding of the question and you select the proper answer. Hopefully this helped. Make sure you check out the shorts below or on the channel. Make sure you are subscribing, you're liking, you're commenting. Let me know some of the things that you are looking forward to or some of the things that you actually need. And I hope you enjoyed this video. So make sure you like, subscribe, and comment. Check out some of those shorts. And thank you to listening and watching Talk, Teach, Nurse. Thank you.